Wonderful. The reason we're recording the webinar today is because we will share this recording with you. So if you're one of those wonderful note takers, but you're having a hard time keeping up, please know that we will be sending the PDF of this PowerPoint presentation along with the recording of this webinar for you to re-access, to utilize, and to share perhaps with others that weren't able to be with us today. We believe in sharing the cause, and we would love to have your partnership in that. A couple other just housekeeping notes is we are going to turn off our videos after we do our introductions, just because it helps with the playing of videos and the bandwidth of the internet and whatnot. So feel free to also use the chat to enter questions. We'll do our best to answer those during the presentation, but we certainly will circle back to any questions that were in the chat that we haven't answered and answer those at the end. So do know that we want this to be as interactive as a Zoom webinar will allow us to be. And I would love to get started today by introducing myself and allowing Erica to introduce herself as well. My name is Jen Rowry, and I am the Director of Advocacy and Engagement for Healthy Birthday, Inc., which runs the prevention campaign, Count the Kicks. And so I am thrilled to be here. I've spent 4 years of my life serving this campaign, but have been a supporter of it since the very beginning. I'm actually next door neighbors with one of our founding moms, Carrie Biondi Moreland, and I was her neighbor when sadly her daughter Grace died from stillbirth. And I was highly impacted by that event and have been a supporter of the cause and the cause for change. And I'm so glad to be here to present one of the solutions for how to get babies here safely. I work with partners. I work with amazing volunteers, high-level volunteers called ambassadors, which is why Erica is joining us today. And I just welcome any partnership along this path that we can get. So Erica, go ahead and introduce yourself.
My name is Erica Bailey, and I live in Kansas City, Missouri. And I'm a mom of 2 boys. My oldest son is Roan, and he is the one in the picture. And he was stillborn at 39 weeks after a perfect pregnancy. And I was not aware of the importance of paying attention to his movements. I didn't know about Count the Kicks. And unfortunately, I didn't learn about Count the Kicks until it was too late. So my pregnancy was perfect. I was low risk. It was my first pregnancy, my first baby, went to all my appointments. And I, as you can imagine, was completely devastated and shocked when, after my son had slowed down, finally got to the point where he wasn't moving. I never reported his slowing down because unfortunately I believed all of the misinformation that perpetuates online and in Facebook mom groups that babies slow down before they go into labor and babies run out of room before in the 3rd trimester. So I didn't think anything of it. And unfortunately, I waited too long because by the time I was 39 weeks, he had completely stopped moving. And I went into triage and got the worst news of my life that he died. After that, when this happened to me, I didn't even know that stillbirth was a thing. I thought this was something that happened in medieval times or 3rd world countries. And I was completely shocked when I learned that this actually happens all the time. And this happens in perfectly normal pregnancies, and it's still happening today in the United States and in Missouri, unfortunately. And as I was researching stillbirth, I found Count the Kicks, which you'll hear about today is an evidence-based stillbirth prevention campaign. And I was like, how did I not know about this? Then I got pregnant with my second son, Bear, a few months later, and I used Count the Kicks religiously with him. I'll go into that later, but long story short, he was a baby saved because when I got to 36 weeks, he slowed down. I reported it. They listened to me. They took action, and he was born healthy and alive and screaming at 36 weeks in 1 day. So I have been on both sides of this, and I am so passionate. I want every person who comes in contact with a pregnant patient to know about Count the Kicks and to spread this message, because I know firsthand how it can save lives.
Thank you, Erica, so much. And we just appreciate that you're willing to share your lived experience and not only help further the message of Count the Kicks, but to bring the silent epidemic of stillbirth out of the shadows, and that we can make a difference. So we're going to go ahead and proceed with our presentation. I'm going to shut my video off, and we're going to start today with just kind of this uplifting yet important video about how Count the Kicks and the app, the free app, helped get an Iowa baby here safely, little Ruby Ekoff. The reason we share this is because it shows the power of an educated parent and being able to advocate for themselves, to speak up. But also we know that storytelling, mom to mom sharing, like Erica's doing today, sharing lived experiences, actually impacts the action of others at even a greater rate than sometimes data and science might. And so we are going to start with this. I want you to pay attention to a couple of things. First of all, listen to the description that Emily gives of the change in her baby's movement and the action that she and her doctors take. We're going to talk about those changes in movement a little bit later on. So pay attention to that. We'll go ahead and sit back and listen.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ekoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ekoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
And the beautiful thing about that is she did. Our app downloads absolutely exploded after this story. And we know of at least 3 different stories where babies were saved because they saw this story. They listened to the testimony of Emily Ekoff, and they got their babies here safely. And so it is such a special story. And there are so many great stories out there. But today we're also hearing about what didn't go well and how we can try to make a change and prevent stillbirth. So what is Count the Kicks? Count the Kicks is a highly effective evidence-based stillbirth prevention campaign. We have developed an early warning system for expectant parents, and we are saving 1 in 3 at-risk babies in Iowa. Our campaign is ready to go, and it's low cost, here to help and support the work you're already doing. So I think it's important before we get too far that we do a level set. We make sure we're all talking about the same thing, that we have the same definitions in mind. And so this essentially is talking about what is the difference between miscarriage, stillbirth, and infant mortality. So a miscarriage is the loss of a baby before the 20th week of pregnancy in that first and early second trimester. Stillbirth is the loss of a baby after 20 weeks of pregnancy and up to the birth of that baby or the end of that pregnancy. It's a baby that never takes a breath on this earth. There are three types of stillbirth, essentially: early stillbirth between 20 and 27 weeks. Then there's late stillbirth, 28 to 36 weeks, and then term stillbirth, which occurs from 37 weeks to the completion of pregnancy. I want to highlight that the risk of stillbirth actually increases in that term time, that late to term stillbirth. And so the risk of stillbirth increases towards the end of pregnancy. Count the Kicks is really a warning system that highly influences the outcomes in that late and term category, more than perhaps the early category, just because movement being established, learning a normal movement pattern for a baby has not occurred at that time. On average in this country, we are losing 23,000 plus babies a year to stillbirth. We are also losing an immense number of babies to infant mortality, which is basically a baby who's been born, they've taken their first breath on this earth to the first year of life, till their first birthday. And we're losing about 22,000 babies annually to infant mortality, which is horrible. But take note, we hear about infant mortality as we should be addressing it. But what we aren't talking about enough in this country is that 23,000 plus babies that are lost to stillbirth. So if you ever wonder, just looking at these slides, what the highlighted, we try to cite everything. We try to give you, we are an evidence-based, research-based organization. And so you can always go to those links and learn more for yourself. So if you're one of those people that loves to read studies, I've included that in the PowerPoint. You can also go to our website, www.countthekicks.org, and there's a whole section on research regarding fetal movement monitoring, as we are pretty laser focused on that aspect of prevention. So causes of stillbirth, there are a variety, but science is indicating that these are the most common, and from top to bottom, the most common to the least common reasons for stillbirth. I'm not going to go into a ton of definitions, but they are pregnancy and labor complications, problems with the placenta, which you'll hear more about. That is why Roan was lost to stillbirth. Birth defects, infection, problems with the umbilical cord, and medical complications in the mother. And unfortunately, because of the lack of research, the lack of funding, the lack of study in this country regarding stillbirth, we don't always have a reason. And part of that is a lack of research, and part of that is perhaps that parents have chosen to not take action with autopsies and finding out more. So there is some freedom of choice, but there is also a lot that discourages our country from moving forward. And that is really important to note for that. Stillbirth by the numbers. So again, stillbirth is way more prevalent than most people realize. In this country, 1 in every 169 pregnancies actually ends in stillbirth. Think about that, 1 in 169 on average across this nation. But what's even more horrifying and completely unacceptable is that there are massive racial disparities that exist and persist in stillbirth. Black women are at very high risk, 2 to 3 to 4 times more likely, depending on the state they live in, especially southern states see that rate increase. But on average in this country, every 1 in 96 pregnancy ends in stillbirth for a Black expectant parent. Hispanic moms have a higher risk at 1 in 199. Indigenous moms are a very high risk group, and every 1 in 138 pregnancies. And white expectant parents experience stillbirth in every 1 in 204 pregnancies, along with Asian Pacific Islanders experiencing stillbirth in 1 in every 233 pregnancies. So again, this is just actually more prevalent than infant mortality, and stillbirth is 10 times more likely than losing a baby to SIDS. We don't dismiss SIDS. We don't think it shouldn't be studied. We want to be more like that Back to Sleep campaign, where safe sleep is a part of the conversation. We want kick counting and fetal movement monitoring to be everyday language in this society, from expectant parents knowing and understanding it to providers understanding it and educating those that they're serving. So Missouri data, like what, let's drill this down, right? I just gave you the national lens. Let's look at the state of Missouri itself. So we do get this information from the CDC Wonder system, if you're wondering where this has come from. And we do look at rate averages. And so from 2015 to 2019, which 2019 is the last time that the CDC updated stillbirth data, another problem in our country is how slow data is to be analyzed and released on the topic of stillbirth. So 2015 to 2019, the stillbirth rate in Missouri is 5.81. So that is very, very close to the national average, but still, when you think about that is a statistic, I want you to think about it in the number of lives. So in the state of Missouri, we lose 431 babies each year to stillbirth. 431 babies, well over 800 expectant parents whose lives have changed forever, along with the providers that are serving them who are never the same. Research indicates that nurses, providers that experience this kind of loss also have some very serious consequences, and 1 in 10 doctors actually consider retiring from the field. So there is a massive ripple effect. When we look at that, that's your annual average for the number of babies lost, compound that times 10 years, and the number of lives impacted. We believe if in Missouri we could save 1 in 3 at-risk babies, which we believe we can, that 138 babies on average each year could come home to those families, and that tragedy could be diverted and prevented. And that's why we have invited you here today, is to talk about that. And let's work together to make it a reality so that there are fewer stories like Erica's story about Roan, and more stories like Erica's story surrounding her second son, Bear. So I also highlight the massive disparities that we see in the state of Missouri. If you take note, the race breakdown for stillbirth, the red is white stillbirth rate in your state. Hispanic and Latino populations are the blue. Black or African-American populations are yellow. And I think it's pretty obvious to see where the most loss is occurring in the disparities that exist and persist are. So what about Iowa and that 32% reduction? Let's talk about that. Let's talk about how that has come about. So in 2008, 2009, Count the Kicks was born. I say that really our nonprofit work had started with the first ever stillbirth registry in the state of Iowa. I mentioned that we're an organization founded out of loss. So 5 Iowa women lost daughters to stillbirth and 1 to infant mortality in the early 2000s. And they were gathered together through friends and pastors to share their grief, essentially, and to support one another. But what they found are some really big threads and commonalities in their stories. And they had a lot of questions, very unanswered questions that they started to ask. And they realized that, hey, stillbirth shouldn't just happen. We aren't studying it. We aren't collecting data on it. So they actually were responsible for creating the first stillbirth registry in the country, as I mentioned, here in the state of Iowa, which led to a national stillbirth registry. So they created Healthy Birthday with the goal of saving just 1 baby, right? Like even if they could save 1 family from experiencing this devastating loss, they felt like it would be worth it. When they learned about the importance of fetal movement monitoring, they all had the common thread of a change of movement in their pregnancy that they didn't know was important, they didn't speak up about, and they realized they could do something different. So 2008, 2009 timeframe is when the soft launch or beginning of Count the Kicks happened in the state of Iowa. And you can see that marked on the graph in front of you. You see blue dots. Those are the Iowa stillbirth rates across this time span of 2003 to 2021. We do get from the state health department, who is a massive partner of ours and a great supporter, and will tell you they believe very much in the work we're doing. You will see that we do have 2021 data on this chart because we're able to get that from the state. And then the red line above is the national average. So you see that it has remained relatively stagnant, while the trend line, the dotted gray line, shows that 32% reduction, that saving 1 in 3 at-risk babies that's happened in Iowa. And we do look at rates over time because we can have outlier years. You notice them on the graph. Things in a low birth rate state like Iowa, like a syphilis outbreak, a pandemic, which we are so thrilled has not impacted our data in as negative a way as it perhaps is impacting other states. And so we look at that trend line. We actually just finished a research study with one of the most prominent stillbirth researchers in the world. And it is going to be another way that we can explain our role in this reduction of stillbirth. So this is what we want to see. We are moving down and we are hoping to continue to save 1 in 3 or more at-risk babies in the state of Iowa. And we want to bring that to you. So what are we doing to reduce those disparities? We have a health equity coordinator on our staff that has a lens internally on our operations and externally, and building partnerships with community-based organizations and other individuals that are already doing really amazing work and have the trust of those they're serving. And so reaching marginalized communities and just spreading the message. And she even looks at how we operate internally, our hiring practices. We've all received anti-oppression and structural racism training. We are trying to shine a light on the lived experiences of people of color and build our programming around that. So we have an app that's in 14 languages, and that is another way we break down barriers, right? And so, and try to reach the largest audience. Our materials are culturally appropriate, and we have videos, printed educational materials, and FAQs in multiple languages, again, knocking down barriers. How did they come to the conclusion? How did those 5 women that started out of grief in that journey together come to the conclusion that they wanted to start a fetal movement monitoring program called Count the Kicks? Well, when they were presenting in a conference in Washington, D.C., they listened to a research study out of Norway where, guess what? The researchers used a cohort of women that were educated on monitoring their baby's movement daily in the 3rd trimester of pregnancy and speaking up if they had any concerns or noticed a change in baby's movement. On the flip side of that, providers were a part of that, and they were educating women to speak up, and they were listening to women who were speaking up with concerns, taking those seriously, and doing the necessary testing and deciding next best steps to make sure that that baby and that mom were safe. And they noticed a 30% reduction in that cohort. When Janet and Tiffin, 2 of our founders, heard this, they literally got on a Southwest Airlines flight home, and on a Southwest napkin, laid out the plan for this is it. This is what we want to do. And that's where Count the Kicks was born, was from this study. Dr. Ruth Fretz remains on our medical advisory board to this day. She's a member of ACOG and was the only US scientist who was a part of this research study, and is a huge advocate for change in this area, including change within the ACOG organization itself. And her quote I just love, so I'm going to read it. "Tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change." So, and this is also the information, the citation on the study, again, if you'd like to look at that. Where else are we finding a lot of favor and support and spreading our wings? The Association of Maternal Child Health Programs has named Count the Kicks as a best practice, and they didn't take that lightly. We went through a thorough scientific review. This AmChimp is essentially the membership organization for health departments across this country and for the Child and Maternal Health Block Grant funds. So we are thrilled to have AmChimp as a partner in our efforts to spread this. The CDC is recognizing that one of the 15 urgent warning signs during pregnancy is a change in baby's movement. They're trying to educate expectant parents here that there is a change in movement, and they're trying to make sure that providers are listening to those women. So one of the big arguments I would say against kick counting is that it creates anxiety within parents, that it creates unnecessary worry or stress. And actually this has been studied, not just by us, although by us as well, with the Harkin Institute and Des Moines University. We did a study on our own app users, and we also have had other studies, which are listed at the bottom of this slide, support that actually it does not increase anxiety. Our app users, 77% of them reported that they felt less anxious. And Erica will speak to this when she talks to you about the app as an app user during her second pregnancy. I think it's especially important for women who've experienced loss to have this tool to not only track their baby's health, but to empower them and to help reduce the anxiety that they naturally have in that next pregnancy. We also know that our app helps moms bond with baby. 84% of our app users stated that regular tracking was associated with feelings of bonding with baby. This is huge. This is huge in preventing ACEs when baby arrives. And so some of you may work with that newborn through children age 5, for example, and anything we can do to prevent those adverse childhood experiences is really important to that child, to that family, and to our communities. And so the app, having that mom bond with baby early on, is a really great tool, even if mom doesn't need the app to get her baby here safely. Other benefits, our executive director is a prime example of the first one, which we believe that we could actually help reduce the preterm birth rate. When mom is monitoring baby's movement regularly and notices a change and speaks up, sometimes she's catching other things. Maybe it's things with her own health. Maybe it's that her body's in preterm labor. And our executive director experienced exactly that. She noticed at 30 weeks a change in her son's movement. She spoke up to the provider about a change in her son's movement and found out that her body was trying to have that baby too early, that she was actually in preterm labor, unbeknownst to her. She spoke up because of baby's movement and concern about baby. Because they were able to intervene so quickly and so early, bed rest, proper medications, a hospital stay, she actually delivered him healthy at 40 weeks, thus diverting a 30-week delivery. Obviously, that would include a NICU stay and other risk factors that come with those early births. Fetal growth restrictions can be identified earlier. Oftentimes, a baby that is experiencing fetal growth restrictions or slowing down is in serious distress, and that happens over time. And that's a slower, unfortunately, demise. And so their movement will change over the course of time. They will slow down over the course of time. And so if baby's movement is changing and mom speaks up and they do the proper testing, they might be able to actually determine that baby is not growing. And then doctors, nurses decide how that medical process should proceed from there. Finally, maternal mortality, morbidity. This is a topic in our country that we're finally talking about, as we should be. And we believe that we actually could help also reduce that rate. We actually have a white paper coming out. Women who experience a stillbirth are 4 to 5 times more likely to lose their own life in that delivery and in the weeks following that delivery. And we know in stories anecdotally that we have received many of them through lived experiences of our ambassadors and baby safe families. We know that a change in baby's movement actually saved mom from a serious health crisis. Let me give you an example. We have a Baby Safe story on our website. If you ever want to read these stories, we go to the Baby Saves page on Count the Kicks website. It's a great lift me up. It shows you the impact. But baby Rocco was delivered in Ohio last year. His mom is a nurse practitioner. He was baby number 4. She woke up at the end of her pregnancy not feeling well, but attributed not feeling like herself. And I wouldn't say not feeling well. She said, I didn't feel like myself. I felt a little off. She attributed it to being at the end of a pregnancy. She had a full-time job. She had 3 littles. That day she'd actually taken off and she'd gone to get a massage. And she noticed at the end of that massage, she realized her baby wasn't moving the way he normally does. She had been using the app to track it. And for her, it was a way for her to connect with her baby because she was so busy. She knew she wouldn't have time to pay attention without some resource like the Count the Kicks app to do that. So she calls her provider, says, baby's movements changed. He's slowed down. They have her come in. They do the proper testing. They realize that mom's blood pressure has gone off the charts. Mom's actually in real trouble. They make a plan, they get baby here safely, they're able to intervene and prevent mom from having a health crisis as well. And we know that strokes and many things like that can impact a mom's survival rate as well. So that is why we talk about that connection between stillbirth and maternal morbidity and mortality. Additional search articles for those that are interested. You can again find more of these at our website, www.counttthekicks.org. And I would just encourage you when we send this presentation out to click those links in the PowerPoint PDF as well. So this is where you get to stop listening to my voice, and I get to pitch it to Erica, who's going to talk more about the implementation of Count the Kicks. Erica?
Okay, so I'm going to go into a little bit more details on what exactly Count the Kicks is and how to use the app. So like Jen mentioned, we're an evidence-based stillbirth prevention public health campaign. We are evidence-based and centered around mom or the pregnant person. When the founders created this campaign, they did so wanting to empower the pregnant people and so that they could speak up for themselves. And we all know how hard and how intimidating it can be to speak about something like stillbirth with your patients, with moms, but it's so important that we talk about it, because if we don't talk about it, then we don't, as patients, as moms, we don't know it's a possibility, and therefore we're not empowered to be on the lookout for ways that we can reduce our risk. So what the founders wanted to do was to create this campaign that would easily allow providers to talk about stillbirth and stillbirth prevention in a way that's not scary, but in a way that's empowering, so that parents can understand what's normal with their baby and speak up if they notice a change. So now we're going to talk about the app. But first, you really need to understand, why does movement matter? There's two key takeaways. And the first one is, a baby's movement is the one way that they are communicating with mom. And this is their way of telling you if they're okay. So this is a very important piece that the parents need to be aware of. And also, a change in what's normal, a change in that baby's pattern in their movement can be an early sign, and sometimes the only warning sign that baby is in distress. So we need to listen, and we need to empower parents with this information so that they can speak up. And that was my case. There was a really good question in the chat that we'll address later, but it was about Dopplers. And my son had a perfect heart rate at every single appointment. And because I was not educated on the importance of his movements, when he started to deviate from normal and he started to slow down, I quieted all of those red flags in my mother's intuition alarm bells that were going off, because I was falsely reassured by his heart rate. And what we now know, what evidence tells us, is that a baby's movement is a better predictor of baby's health for parents to speak up. So when we talk about changes in movements and why would that mean a baby could be in distress, I want you to think about how you feel and what you do when you don't feel well. So when you feel sick, you might want to lay on the couch, you might want to lay in bed, you might want to rest and conserve your energy. It's the same thing with babies in utero. When they're not feeling well, they're going to conserve their energy. Their movements can become less frequent, they can become weaker. Just what is normal before is different now. And the reason that is because to conserve blood flow and energy to vital organs such as the brain and the heart, all that energy is going to go to those. So they're not going to move as much. They're going to, it's going to be different. So that's why it's so important. And there's 3 different types of movement changes when we talk about, like, what is a change in normal? So the first one would be a change in the frequency. There's fewer movements or no movements. The baby has slowed down. That would be a change. Secondly, there's still the same amount of movements, but they feel different. They feel softer. They feel weaker. That would be a trigger to come in and get checked. And lastly, this one is very important for everyone to know. It could be a wild, crazy surge of movement that feels super fast or super violent, super strong. This can also be a sign that baby is in distress. Many moms who have a child who is stillborn will report this crazy obsession of wild and crazy movement before their baby passed, before their baby died. That's what happened to me. And as a first-time mom, I had no idea what to expect. All I knew was this was crazy. And I thought, well, maybe this is a sign that I'm getting ready to go into labor because I was 39 weeks. It wasn't. It was a sign that my son needed help and I didn't know because I wasn't educated. So when should a parent start kid counting? They should start, the general rule is 28 weeks, unless you know the patient is high risk, and then the guidance would be to start at 26 weeks. And this is because research has shown that this is when baby's normal movement pattern has been established. So obviously people will feel movements before that, but they really don't need to start counting regularly until 26 or 28 weeks. I personally liked starting earlier just to get practice using the app, but I didn't pay too much attention to the data and what the variances were until I got to 26 weeks. And what would count as a kick would be anything like a roll, jab, punch, kick, anything besides hiccups, because hiccups are involuntary movement. Okay. All right. So how to count the kicks is very easy. There's 5 easy steps. So once you get to 26 or 28 weeks, your patient would download the app. It's free in the App Store, and we'll talk about that later. So you would download the app, and if they don't have a smartphone, we have paper charts that they can print from a computer to do it by hand on paper if necessary. So once they have the app, they would choose a time every single day to do their kit count. We recommend at least once a day. I personally like doing it more than once a day, but at a minimum, it should be once a day, the same time every day when baby is most active. Typically that's in the evening, so you're comparing apples to apples. Then third would be to time how long it takes baby to get to 10 movements. And after a few days, you'll start to see a pattern, how long it takes to get to 10. And then also we have another feature, which we'll talk about, but the feelings of the movement. And we want them to do this every single day. And if they notice a change, go in and get checked, call your provider and let them know right away. Even if you've had an appointment that day, even if it's a holiday, even if it's a weekend, as soon as possible, report the changes. So our app is obviously our hallmark resource tool. So I want to go into that a little bit. It's been downloaded over 160,000 times in over 140 countries. There are no advertisements or pop-ups in the app to distract the user or slow down the kit counting session. And we're always getting feedback from our users on how to make this better, to make improvements. So our app is free and it's available in 14 different languages. It's available for Apple and Android products. They can, if they start a session and they mess up or they get distracted, they can restart the session or they can delete it, delete a kick and pick back up. You can set a daily reminder to do your kick count. We all know everybody's busy. Pregnancy brain, grief brain, mom brain are real things. So we wanted to have that feature in there for you. You can review your kit counting history and download that to share with their provider or with their doula or with anyone else. You can email it straight from the app. You can also use Count the Kicks for twin pregnancies. Unfortunately, you can't use it for other multiple gestation or other multiple pregnancies like triplets and above because it's just hard to differentiate which baby is moving. You can track multiple pregnancies on the same profile. So next time I get pregnant, I will have my profile and I can add my next pregnancy. But I want everyone to know that every baby is different. Every pregnancy is different. So to not compare, you know, their third baby to their second baby or whatever, because each baby is going to be different, and that's important. But it's just nice to have all the information in one profile so you can go back and look if you want to. You can have multiple devices registered to your account, so you can use it on multiple phones, iPad, and on a smartwatch. And then I just want to remind you that if they don't have a smartphone, they can still download our kid count sheets for free on our website and print those out and do it by hand. Okay, so this is a nice new feature that we have recently added, our strengths and notes feature. So at the end of every single session, the user will be prompted to rate the strength of the kicks from that session on a scale of 1 to 5. And 1 foot would be fluttery, like think of movements at the beginning of pregnancy, those kind of butterfly feeling movements, that would be fluttery. And then all the way to 5, which would be fierce. And that would be like you can see the movements from outside of your belly and it feels like their limb is about to poke through. That would be a fierce. So the user will rate the strength, and then there's also a box for them to add in notes, which is really nice. So you can see here, after each session, it will give you a recap of the last 7 sessions or the last 5, and you can see if the duration, the timing of the session starts increasing, or the strength of the movement start decreasing. That would obviously be a sign to go in and get checked right away because something is off and baby is not moving like its normal pattern. Yeah, and we want to remind you that there are, I know some of you work in hospitals, but labor and delivery triage is available 24/7. Like I said, they're there on holidays, they're there on weekends. And when in doubt, please tell your patients or the people you interact with to go in and get checked and call on their way there. That's what they're there for. They're there to help people bring their babies here alive. So they're happy to do that. All right. We also have video capabilities in our app to show and educate users on how to count their baby movements, how to use the app, and then we have why kick counting is so important, different types of tutorials, all available in there in video form. Jen, I'll pass it to you.
Thank you, Erica. One feature we do want to tell you that we've added to the app. So we know social determinants of health can really impact a healthy pregnancy, a healthy mom, a healthy baby, right? If you don't have access to proper nutrition or safe shelter or medical care, those are all going to impact potentially the outcome of your pregnancy and certainly your experience. So in the app, in the resources section, again, the app is free. I encourage all of you to download it. Get to know it, play with it, share it with those that you're educating, to show them how simple it frankly is. And but here, if you enter your zip code for your region, which when you download the app, please also do this. And what pops up, say if I put in Johnston, Iowa's zip code, there are 2,026 programs available, everything from food, housing, legal, financial, transit, healthcare, resources, free or low cost resources that could be available to that app user to try to connect them with the services that they may be in need of. And so if there are services that are not listed in your area that you'd like to see added, this is a living resource. It can continue to grow. So just another way we're trying to serve those communities that download this free tool, again, with no ads or pop-ups. I do love this video, so I'm going to show it. And while I'm showing it, you could even take the time, one of the rare times on a webinar or a presentation where the presenter may encourage you to do something different, but download that app while you're listening, play with it, get to know it. This is a really quick video that shows you how the app works in real life.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So that free app is a great resource. I have never used it during pregnancy because my babies are way too old, but I have used it and testing, and I will tell you that Apple Watch feature is super handy to have that right on your wrist. So really cool new feature. So Count the Kicks implementation in you. So there are a variety of audiences here today. Everybody that might be working in a hospital system as a nurse, or maybe it's a home health visitor or a WIC worker. Perhaps you're working with a community-based organization that serves expectant parents. So you may have to hone in on when you're interacting and how you're interacting based on the job that you're doing. But one thing that's really true and important is this: health literacy is one of the strongest indicators of an individual's health status. So what they know and understand and how they can actually work through the medical system is a real thing, and it can be a real barrier. And so we want you to be thinking about ways that you could have a healthy dialogue, which is a key to prevention. And so we have 5 ideas we like for you to consider in how you have important conversations with your parents, and probably in every health topic, but obviously today we're talking about kick counting. And we know that everybody that's on this webinar cares. We know that no one wants a bad outcome for mom and baby. And so we're really grateful for this partnership and this time to learn together, and are always open to dialogue and continuing the conversation. But I think that this is really important. Be equitable, avoid assumptions, and provide all expectant parents, no matter race, gender, religion, socioeconomic status, sexual orientation, marital status, or education level, the same information and interaction. Make 0 assumptions. Everybody needs this information. Erica is an engineer and did not know about the importance of speaking up and kick counting. And that doesn't mean she's not educated. She wasn't educated or literate on baby's movement. In fact, 12% of US adults have the health literacy proficiency to perform complex health tasks. Even patients with high levels of literacy have difficulty understanding health information and services. So as an organization, we encourage you to take a systematic approach so that all patients are given the same information, which will remove those assumptions that an individual has that ability or knowledge. This is key. Organizations that are doing a good job of serving patients are making these types of changes. You need to be listening and learning to the expectant parent. Ask strategic and open-ended questions about kick counting to help you assess what that individual patient understands, feels, and desires. Please avoid closed-ended questions that could prevent the conversation and actually cause confusion. An example is your baby moving? This is a yes or no answer. I have countless ambassadors who have lost babies that say this is the only discussion that ever happened with them about baby's movement was this question: is your baby moving? And all of them were yes, because the answer was yes. At that time, baby was moving. What they didn't know is if their baby was moving normally, If their baby had slowed down, had sped up, if the strength of movement had changed. They weren't tracking it often enough to know. And the other dangerous and confusing part of that is they were unsure that it mattered. The message in the room was, is the baby moving? Yes, they felt like they'd answered the question. No big deal. Move on. So I encourage you to think about open-ended questions that allow you to learn what the parent knows and understands. Some examples. Tell me about your baby's movements. How is tracking your baby's movement going? Do you know what to do if baby's movement changes? And have you, as a provider or a support person, armed them with what to do if they notice a change in movement? Do they know where to call? Do they know if they should wait? Hours and minutes can matter. We don't want them in a call queue waiting 4 hours. I have an ambassador who lost a baby who had brainwaves when she got to the hospital. She waited for 3 or 4 hours for that call back from a nurse. That baby was viable and could have survived. So really, we want to make sure that we're thinking about what we're asking and that we're projecting that this is an important conversation. Another question, can you show me your Count the Kicks graph? If you know they're using the app, or if you know they should be using the app, please do that. The one thing I want to point out is we as individuals don't have control over others. You can provide as much information and encouragement as possible, and someone still may not download the app. That doesn't mean that the conversation is not vitally important, because women who know that movement matters, if they're made aware of that and the importance of speaking up, even if they're not tracking it daily, they will have a consciousness about them to perhaps trust their instincts and notice a change and speak up anyway. When they know that movement matters and that it's important to speak up, they really are a step closer to a safe delivery. Be clear and concise. Avoid long and complex explanations and medical terminology. Please consider using everyday vocabulary. And this is why Count the Kicks is so mom focused. If you notice our educational materials, which we're going to talk more about in a minute, they are definitely bright, cheery. This is not a dark, fear-based campaign, and it is not medical. It is really focused on the audience, and it is clear and empowering. It is free and low cost. There are other resources for providers and patients that are ready to go, like our Parent Academy and our Provider Academy on our website. Finally, be honest. Speak the truth while still practicing empathy and compassion. Pregnancy is full of risks that we educate parents about. Stillbirth should not be the exception, and kick counting should be a standard of care because it is preventative medicine. We practice all forms of preventative medicine. Take a prenatal vitamin to prevent a deficiency in folic acid and the birth defects that can come from that. Take a gestational diabetes test so that we can monitor you if you have a risk factor for your health or your baby's health. Go get a mammogram, not because we're trying to scare you into being fearful of breast cancer, but because we know early detection matters. Just like early detection in a baby's change in movement matters. This is preventative medicine, and we have to stop hiding from it. We need to have those clear but kind conversations. And finally, reteach. You should know before you leave that room what that individual is thinking, what they understand. And so if it is not clicking, go back to the reteach mode. If you still feel like they need additional resources or support, perhaps there's a language barrier, a learning barrier. There's some barrier that needs to be addressed there. What can you do to make sure that they get the support and the resources they need? I'm a former educator, a former high school teacher, and that is what good education is. And I believe that education is and knowledge is power. And your job is to help provide that knowledge and empower your patients or your clients or the expectant people you work with these tools and resources, because it's going to help you do your job better and it's going to help us have better outcomes. And that's what we all want. So Erica has experienced stillbirth, and she can tell you, and she has mentioned more about this, but I would love for her to talk to you about how to have that conversation. And here are some reasons why people don't, and she's going to debunk these myths.
Yeah, so everything that Jen said happens to so many people, happened to me. I was only asked if my baby was moving, and yeah, he moved all the time. I actually remember asking if I should count kicks because my son was active all the time, and I was told not if it causes anxiety. We already know based on evidence that most app users have reduced anxiety and greater feelings of bonding when they use the app. I will just say the perceived anxiety from kit counting is nothing compared to the anxiety, depression, and PTSD that will forever haunt me from having a child die. So please have these conversations. They are so important. And as a pregnant person, we are informed about so many things that can happen. Neural tube defects from not taking the prenatal with folic acid. We know not to change the cat litter box. We know not to eat deli meat. We know, all these things. This is just another thing that we can be informed about to empower us to have a pregnancy with a healthy birthday at the end. So you might think, well, I don't want to scare moms. And like I just mentioned, pregnancy is so full of risks. This is just another one we deserve to know about. Well, stillbirth just happens. There's nothing we can do. This is not true. Many stillbirths are preventable, and many come with warning signs like a change in movement. So if we know what to look for, we can be aware and speak up. Her baby is always active, so it's not a concern. Well, the baby is going to be active until it isn't. And a lot of the stillbirths can be sudden with a cord accident or a placental accident. In my case, my son had an undetected small placenta, because placentas aren't measured in standard prenatal care. So during the last weeks of his pregnancy, he was slowing down. His placenta was running out of gas. If I had known that slowing down was a sign that something was off and needed checked, I could have spoken up. And I have zero doubt that if I had, we could have intervened and my son would be 2 years old today. He was born March 5th, 2020. She's almost at her due date. Well, unfortunately, the risk of stillbirth goes up the closer you get to your due date, and then increases rapidly as you pass your due date. So it's even more important during this time. When you have a patient who has had a previous stillbirth, they are actually 4 or 5 times higher risk for another stillbirth. And this is especially true if they never got a cause for the first stillbirth, which, as you learned earlier, many stillbirths don't come with a cause at the end. So how do you talk to these patients? Have the same conversations. And since they have had a prior loss, they are now high risk. So they need to start counting at 26 weeks. Please feel free to acknowledge their child who is stillborn. Ask what their child's name is. Ask, how did they pick out that name? Ask them to tell you about their child, just like you would with people who have living children. It's so important. Avoid sterile medical terms like fetal demise, because they're insensitive to a lost parent, and be empathetic. They are still our children. They're still a part of our family, and we don't get to talk about them a lot. So it's really refreshing when a provider or doula or anyone asks us about our children. And ask if they know about the importance of paying attention to fetal movement, because most of the time they were never educated, and they might not know in their subsequent pregnancy how important it is. So these next 2 slides, if you take away anything from this presentation, please pay attention to these 2 next slides, because they are so important. So we're going to dispel some common myths about kid counting and stillbirth.
So my baby.
Jen, I can just go through these if you want.
Sure, absolutely.
Okay, so you've heard my baby is always active, so I don't need to count kicks. False, because even active babies can experience distress, and sometimes it's very quick and without other warning signs besides a change in movement. And if you are monitoring, like in our app, it takes the guesswork out. Well, is my baby slowing down? Because technically it could still, in my case, my son's slow days would have still hit the outdated guidance of 10 kicks in 2 hours, but that was not my son's normal. So if I had been using the app, it would have been clear as day that he was slowing down, and I could have alerted my healthcare provider. The next one is, I'm very passionate about this because my second OB I had with my rainbow pregnancy, she knew about Count the Kicks, but she was only educating her high-risk patients. So should only high-risk patients do Count the Kicks? No, we want everyone to do Count the Kicks. Every pregnant person deserves to have this information because many people are like me. They are not high risk until they became high risk. So I was not high risk until my son died. So please tell all your patients. My baby should get 10 kicks in 2 hours. We've all heard this one, and this is very outdated advice. This is false. Every baby, every pregnancy is different, and to give out a blanket recommendation of 10 kicks in 2 hours is not accurate for everyone's baby. So what we recommend and what the current research shows is that moms should get to know their baby's normal, what times of day they're active, how long it's taking, the strength, and go off of that. And if that changes, that should trigger them to go in and get checked. Okay, this was a question in the chat, so I couldn't wait to get to this one. I can just use a Doppler device to monitor my baby's well-being. False, false, false. And a change in baby's heart rate is going to be one of the last things that happens before a stillbirth. And I would say most parents are not trained on how to use a Doppler or to interpret those results. So it's not an accurate depiction of baby's well-being. If they are concerned, they need to come in and get checked. Don't waste time using a Doppler. I like to use the analogy of using a Doppler to measure baby's well-being is like watching a car drive by at full speed and not knowing how much gas is left in the tank. Okay, you can see it driving, you can see it's moving fast. Just like my son, he had a perfect heart rate the day before he died. If you're not paying attention to that baby's movements, you don't really know how much gas is left in the tank. And by doing so, you have a better indication of if baby is okay. The next myth is, if my baby isn't moving, I should just drink a cold drink and eat something sugary to get my baby to move. We've probably all heard this one, and I was actually told this one when I called in when I was concerned at the end. This is false. Research has moved away from the idea that if mom feels like a baby is in distress, that we should, spike her blood sugar with something sugary or drink something cold to get baby to move. Babies' kick counts are best monitored without any of these interventions, and it's just really outdated advice. So this is so important to please educate everyone who's answering the phones at your facility to, when people call in, to not give this advice, to instruct patients to come in if they're concerned, come in and get checked. All right, the next one is babies kick less at the end of pregnancy. This one, unfortunately, is perpetuated online, and I can't wait to get this one dispelled forever. No, babies do not kick less at the end of pregnancy if they are healthy. The types of movements may change. It could be less like kicks and pokes and more like rolls and jabs as baby grows, but the baby should still move at the same times each day. It should still take about the same amount of time to get to 10 movements. The strength should be the same. So this is not true. Okay. The next one is pregnant people, pregnant people should avoid dental care. This one is false, and we've added this one in there because good dental health is always important, and pregnancy can increase an expectant parent's risk of dental issues and thus overall health issues. So pregnant people still need to be getting dental care. And the last myth is triage doesn't need any Count the Kicks education. This is false. Labor and delivery triage is the perfect place to have this information, because when parents are concerned and coming in and being sent home, they need to be educated on what to do when they go home. So putting up our free posters, brochures, discharge papers should all be touch points where we can put this information so that anytime a pregnant person comes in the third trimester for anything, they are getting this Count the Kicks information before they get sent home.
Thanks so much, Erica. Whoops, I think we skipped a little bit there. I want you to think about systems change. How does your system work? When do you interact with expectant parents? How do you serve expectant parents? All of the answers to those questions are going to be based on the work that you're doing and the role you have in the organization you're in. But I want you to think systems change. How do you interact and how can you incorporate kick counting education into the work that you're already doing? So if you have discharge paperwork, for example, somebody comes into labor and delivery triage with a concern and they leave, right? Everything checks out, we send them home. Can you put it in the discharge paperwork? Have all front desk staff trained. So depending on if you're in an urban or a rural area, different hospital systems especially have different protocols for who they're interacting with. In a lot of rural settings, that front desk person is kind of like the school secretary. You have to get past them, right? Like they know how this all works. And if they're the ones giving advice and saying, oh, we're just going to wait and do a callback when someone reports movement, those could be the hours and minutes that matter. Include in a family care or intake form. If you are especially a community-based organization and you're collecting information, where can you squeeze information about Count the Kicks in so that those expectant parents have that information? Could you do it during glucose testing if you're a facility that's or a nurse that's providing that? It's a great time to have the discussion, download the app, answer any questions. Everybody's just there waiting anyway for those results. And it's right close to that third trimester when that all happens. Could you incorporate this into your emergency medical records or electronic medical records or your electronic health records? Where can you incorporate this in to make sure that every appointment in the third trimester that an expectant parent goes to, and if they're high risk, starting at 26 weeks, slightly before that third trimester, where can you incorporate it in to make sure this discussion happens and that the expectant parent's prepared to have that conversation? And finally, a lot of facilities have call queues, right? You get put on hold and it says, oh, we have an amazing event coming up, or make sure you check out your health records at unitypoint.com, whatever it is. Can you add Count the Kicks information to a phone recording for patients when placed on hold? So download the free Count the Kicks app today and track your baby's movement in the third trimester. We want to know and hear from you if you have a change or a concern. It could be as simple as 2 or 3 sentences and be the difference in saving a baby or losing a baby. So here's an example of that after visit summary where a hospital system in Mary Greeley included Count the Kicks in that after visit summary at their clinic, or that could be discharge paperwork. Celebrate One is a nonprofit organization in Cleveland, Ohio that only gets, this is their intake form. They only get one contact with a parent and pretty early in that first trimester time period, but they included Count the Kicks in that intake form so that they knew that touch point occurred. If you're a childbirth educator and on this call, or if you know childbirth educators, we have free sample lesson plans for childbirth educators. I have New Jersey childbirth educators that are loving this resource and using that in their lessons. And we talked about electrical or electronic medical records and integration. So I'm just going to kind of fly through that. Remember the importance of speaking. You have to say it. It's so important. If you're a provider or a nurse on this phone call today, I can't tell you the difference it can make if you give permission to an expectant parent to speak up. If you simply say, we want to hear from you. It is our job to serve you. Hospitals are open 24/7. We would rather you speak up and everything be fine with your baby than not speak up and you experience loss. If you simply give permission, that self-doubting mom will act on it, much more likely to act on it than if she gets the feeling that she's going to be a bother. Again, we're not seeing increased anxiety. We're not seeing increased phone calls and visits to ERs because moms actually have data. They're informed. They know when to speak up. Instead of being based on feelings, you're actually basing it on data and information if they're using that app the way that it's supposed to be used. We do have free resources we're going to talk about, so send a brochure home, have those open-ended conversations. That health literacy is so important. Speaking of resources, this is your time. We would love to see you order Count the Kicks materials today. This is on your screen. I would love for you to do it right now. Anyone that orders materials right now and or within the first 15 minutes after we end this webinar, we'll get a name put in the drawing for a free Amazon gift card. We want to see the orders fly off the shelves. Why? Because we have great resources already ready. And guess what? Because of this great partnership with the Missouri Department of Health, they're free. They're 100% free resources. You simply have to order them. You can go to www.counttthekicks.org, go to the state of Missouri, and fill your cart. You can get promotional posters, how-to posters that you can hang in waiting rooms, bathrooms, clinical rooms, library bulletin boards. There is no public space that doesn't intersect with an expectant parent at some point. Hang these posters up, no matter if you're providing health services or you're a community-based organization. Where do these items need to go? Local courthouses, wherever it is, hang up posters so that you're raising awareness. It's a simple and free act of kindness. You can get app cards, little business-sized cards that you could hand out to an expectant parent anywhere and ask them to download the free app. It doesn't have to be a scary conversation. It could be, oh, I see you're expecting. I have this great app that is really easy to use and important, and hand them an app card and let them know about it, giving them that chance to have the knowledge so they can empower themselves. The most important tool probably is our brochure, because it actually talks through those how to count your kicks and how to download the app, that type of thing. I would love to see every single facility find a way to use these free resources that the Missouri Department of Health actually has provided to you. So again, go to www.counttthekicks.org, click on the great state of Missouri, and fill your card up and get those materials. They should be there within 7 to 10 days, at the most 14 days, depending on, UPS and the United States Postal Service. But we have a great partnership and a fulfillment center that is doing amazing work to get those out the door as quickly as possible. So again, we would love to put your name in a drawing for an Amazon gift card for ordering those materials between now and the last 15 minutes following the end of this presentation. So if you're not a multitasker, I'm not a multitasker, and you're not ordering now, as soon as we hang up, please take the time to do so. What other resources do we have? Free training for continuing education. You can get 1.5 CEs with our free Count the Kicks training, and you can simply use the link that's going to be sent out afterwards and put in a code called Save Babies Missouri and take this free 90-minute training on Count the Kicks. Other free resources are on our website, our YouTube channel. They're full of free resources. That Parent Academy, Provider Academy, the downloadable kick counting charts for those that don't have access to mobile technology. All of that is available for free. And then, of course, we have amazing free resource called our Count the Kicks ambassadors, who do great work like Erica does, reaching out to organizations, providing educational trainings, giving them the opportunity to speak. If you would like Erica or Maria or Miranda, your Missouri ambassadors, to talk to your group or to provide a training, or if you'd like to just discuss more ways for how we can partner with you, please contact us after this presentation. We are here to serve and support the work that you are wanting and needing to do. And we especially want to reach those marginalized communities, those most at-risk moms. So next steps, familiarize yourself with that Count the Kicks app, practice, order those Count the Kicks materials, make sure you're taking 3 to 5 minutes with your patient to educate, empower, and have that kick counting conversation at every single visit in the 3rd trimester. No exceptions to that rule. Make sure you have looked at systems change, and remember, hours and minutes matter in preventing stillbirth. You can educate and empower someone to save their baby today. We have so many great baby saves. Here are some. Little Eva is actually a baby save from the state of Missouri, and she's there in the middle. And we have another Missouri baby save in Baby Bear. And so, Erica, would you like to share your story quickly?
Sure. Like I said, after my son Roan died at 39 weeks on March 5th, 2020, a week before the world shut down, A few months later, we got pregnant with my second son, who was sitting in my lap, Bear. His pregnancy was obviously high risk because I had experienced a stillbirth before, and we also had some other complications. So I started using the app at 26 weeks. I personally used it religiously. I probably used it 4 or 5 times a day. And it, as you can imagine, a pregnancy after loss is filled with a ton of anxiety, fear, just all the things. It's the second scariest thing that lost parents ever have to do, is being pregnant again after a loss. And it was a very high anxiety time. And I found that using the app personally gave me such peace of mind, because at the end of each session, I would know that if he was moving his normal amount of time, same schedule, same strength pattern, it was an instant feedback that my son was okay. And I also found that it really helped me bond with him, because I learned his patterns. I learned what was normal for him, which can be really challenging in a pregnancy after loss, because you're so afraid of your child dying that it's hard to get attached. But I actually found that this really helped me bond with him. When I got to 36 weeks, I woke up and my son was not moving like his normal. Every morning I could wake up before 7 and I could do a kick count, and it would take him 10, 15 minutes to get to 10 movements. Well, this morning I only felt like 1 or 2 kicks. So immediately I was high alert, and we had an appointment within the hour at our MFM, our high risk doctor. So I went in and I told them my son is slowing down. So they hooked me up to a non-stress test, and lo and behold, his heart rate kept dropping. So they decided to monitor me for a few more hours, and his heart rate kept dropping. They actually offered me orange juice to try to stimulate movement, and I was like, no, I will not, this is not going to reassure me, because I know that he is not moving like his normal. And I'm not going home. This is not going to make me feel better. So they listened to me, and they said, based on your history, based on what you're telling us now, and based on his heart tones, we're going to admit you and we're going to have this baby. So they admitted me, and the next day, luckily, I was already at 5 centimeters. They broke my water, and he was born 4 hours later, healthy and alive. And to this day, we still don't know why he was in distress. We did find out later that his placenta had the same genetic abnormalities present that my first son had in his placenta. So we don't know, was his placenta shutting down? Was it about to stop growing? And that's why my son was in distress. But I have no doubt in my mind that had I not spoken up and my providers not listened to me, that it could have been a completely different outcome. So I'm so thankful for the app, and I'm so thankful for all of you being here and learning how to empower parents to speak up for their babies and save their lives.
We're so thankful for you, Erica, for taking and being courageous and sharing your experiences so that we can all be wiser for it. And so I want to encourage you to connect with Count the Kicks. We are on all the social media channels, and also invite you to the State of Black Maternal Health during Black Maternal Health Week. A very important conversation about those disparities that we all know exist and persist. And it is on Tuesday, April 12th at 12 p.m. You can go to a link called at bit.ly for Black Maternal Health Week _SO. So State of Black Maternal Health is what that stands for. And again, this will come as a link to you in this PDF, but we encourage you to learn more about the state of Black maternal health and the disparities and what you can do to help change that story, because I think it's important not only to talk about a problem, but to offer a solution and to take action to make change. I thank you for sticking with us on our little bit long presentation, the 13 of you that were able to stay with us. We are forever grateful for your time and your attention, and we would love to go ahead and answer any questions. You can enter those in the chat at this time. So if you are interested in asking any questions, anything at all, we would be here to answer those and be glad to do that. Erica did drop her email in the chat. You can also find her on our website on the ambassador page and click the email me button if you don't get this copied down or it's incorrect. And I will also include it in the follow-up email. I'm glad you found it informative. I hope you also felt the passion and the ways that you can also partner with us in change. Thank you, Tony, so much. Easter Seals is a great organization. Yes, thanks, Leanne, for coming on and being with us today and helping save Missouri babies. Yes, the recording will be available. I'll be sending the PDF of the PowerPoint and a link to the recording later today is the goal. So early tomorrow at latest. So yes, you can certainly use that. If you have any questions or you would like a training in a hospital system or public health system of any sort, or you have ideas on how we can expand Count the Kicks in your state, you are 100% welcome to reach out. Erica, Maria, Miranda, myself, we're all here to educate. We really believe in the work we're doing. So excited that you're excited. Awesome. Thank you, Cindy. We appreciate it. We appreciate it. And we just, that call to action, remember, order those materials within the next 15 minutes and your name could be entered in a drawing. Really reward us by filling your carts and ordering materials today, downloading that free Count the Kicks app, educating yourself so you can educate others. And every expectant parent in your family, your friends, not just in your organization, right, but in your community, you can really impact change and be an advocate for change. The other thing that I want you to know is that we are working on federal level stillbirth prevention legislation. So there is a Maternal and Child Health Stillbirth Prevention Act of 2022 that has been introduced in the Senate and the House and really addresses the fact that the Title V grant to maternal child health state health departments does not have the word stillbirth in it. Another example of how this has been hidden from society and needs to come out of the shadows. So the Shine for Autumn Act, and then there's another act that should be announced. So we're starting to move the mark on stillbirth prevention, but we can only do it with great community support and members and each one of you. So thank you so much.
I will also add really quick that we are also working to get new legislation introduced in Missouri for a stillbirth tax credit, which unfortunately is not prevention, but we know this happens to over 430 families a year right now. And this would allow parents with a stillborn child to receive a one-time tax credit to help cover the unexpected expenses that come with the death of a child, like funeral, burial, autopsy, headstone, therapy, all of that. And we have a bill introduced in the Missouri Senate, and it's waiting for committee. And we have one introduced in the House. So if you feel compelled, I love having Missouri residents contact their legislators to help us get this passed to just help bring awareness that stillbirth is still happening and we need to do something about it.
Wonderful, ladies, and thank you again to the Missouri Department of Health for their support of this presentation. And we will just look forward to connecting with you at another time if there are no more questions.
Thank you all.
Thank you. Have a great day.